a case study. We have another theme is floods, and this is very pertinent because it's very close to us here. So flooding, we have a case study from Baringo, and it was co-authored by Christine. So if you go, and we are going with the 3 journalists on Saturday to Baringo, you see how floods have really wreaked havoc there. So there's this phenomenon where all the lakes in the Rift Valley in Kenya have been expanding. So as they've expanded, they've encroached on settlements where people used to live. So last year I went there. There was a health facility that is underwater. So people cannot go to the facility, to the dispensary to get medicine. It is affecting, it also has impacts on sanitation because people's toilets are swept. And so drought. So there are many case studies there that you can read. So there's this map. So as you can see, where there's green, there's a case study. So as you can see, so many greens. So there are case studies from North America, Southern America, Asia, even Australia. But this area here is Africa. Just that it's on a white background, so you can see all this area is Africa. So if you click, let me click, for example, here, this is Kenya. So if you click Kenya, yes, it will tell you about the Baringo. So that's the case study I was talking about. So floods, so it's around, tells you about how flooding has been affecting the people in Baringo. So if you click here, Ethiopia. So in Ethiopia, it will, this must be a case, this is a case study on the Gumuz people. Yes, the community, you know, when they were building the dam, the Grand Renaissance Dam in Ethiopia, there was a community, a minority community that was displaced, because when you're building a dam, you have to. So that community was affected by that development. So there's a case study there. There's also a case study. If you click here, this is Somalia again, another neighboring country to Kenya. So in Somalia, it's about sanitation in IDP. I don't know, it's not going through. But now if you click here in Namibia, like I was saying, lack of access to water. So the settlement where the San people are living, so they don't have boreholes, and you know Namibia is mainly, they have desert conditions, so it is very important to have things like boreholes and sewage facilities for the communities there. So as you can see, this is just so Nigeria. I was telling you about the oil pollution that is ongoing in the Niger Delta. It's affecting the Ogoni people very much, because, like I was telling you, so that is so as you can see, the report is, you can also read and case studies from elsewhere, but I wanted us to mainly focus on Africa. So as you can see, these pictures, they are all telling stories. So when you click on a photo, it takes you to the case study. So if you click like here, I took this, so this is Kenya. So it will bring you the case study from Kenya. So Christine, as you can see, was one of the authors. So I took this picture last year when we went there. So this is a place in Baringo called Loboi. So where that lady is called Josephine. She's a community health volunteer. So that is that's a dispensary that is underwater. So they cannot access it because of flooding. So this is just not too far away from where we are. So you can read the whole case study, and it gives you the history of the Endroys. They have also suffered evictions, also in the name of conservation. It's a community that has been affected a lot. So flooding just complicates, because most of these communities are already marginalized because they are fewer in number. They do not have a voice. So they are already marginalized. Now we can see how the changing conditions around environment, affecting them, climate change, everything. So it is very important that as journalists, when we are doing our work, that we cover these communities that most times do not have a lot of voice, and they are mainly left out when we are doing stories around. Because Geoffrey will explain here, he's been doing a lot of work around budgeting and involving such communities when they are doing a budget in the county. For example, do you consult them? So trying to get these communities involved in such very so that they are not left behind as countries are doing all these development projects and everything. So they are. So on top, these communities are already marginalized, but within the community, there are people who face further marginalization. So if you are Endorois, you're already marginalized. Then within the Endorois, if you have a disability, that's another marginalization on top of a marginalization. So it is also covered here. So all these angles are very brought out so that we make sure that they are not left behind.
Good morning. My name is Geoffrey Nyakundi Kerosi. I work for Minority Rights Group International, or Minority Rights Group Africa. I would explain the difference. I've been working for the organization since 2019, supporting projects in Kenya and Ethiopia. So I'm the country representative. So basically, in addition to what my colleague Billy said about the organization, we have Minority Rights Group International is our main organization, but it has chapters or offices. We have the Minority Rights Group Africa, which is has an office in Canberra, and we work across Africa in the countries which you mentioned, including Uganda, Kenya, Ethiopia, Malawi, Zimbabwe, Tanzania, Ghana, and other countries. Then we have Minority Rights Group in Europe, which also covers the countries in Europe and Asia. We work through programs, publications, we do advocacy at various levels, from the county level all the way to the international level. And then we have a number of projects which we are running here in Kenya and Ethiopia. But before I go there, I will mention that in our strategic plan, there are three main targets. Objectives. The first one being combating persecution around the world. The second one being challenging marginalization, as well as securing inclusion. And finally, realizing climate justice. So most of our projects in Africa or in Kenya and Ethiopia, they are focusing on challenging marginalization and securing inclusion. As one of the things which I wanted to mention, which is important before I talk about the projects we do in Kenya, is that MRG, or Minority Rights Group International, was founded by an editor. Actually, even the first employee was a journalist. And the reason why this editor founded this organization 50 years ago was to challenge marginalization. Because for the editor, every day stories were coming to his desk, and these stories were touching on persecution of indigenous people around the world, or ethnic minorities around the world. So he decided one day to found an organization. So he called a press conference in 1968 and announced that he's going to form an organization called Minority Rights Group International. And the first employee was an Sorry? Yes, the founder is called David Astor. He's a British man. He was working for Observer. The Observer is a newspaper in the UK. So he just, like that, he said, now, because there are too many news coming on marginalization of indigenous peoples around the world, let me found an organization which can deal with these issues. And even the first employee was a journalist from South Africa. So we have a number of projects which we have implemented here in Africa, in Kenya, sorry. The first project which I was involved in was a project to tackle reproductive health rights for minorities, and we were focusing on Somali women because of the simple reason that most Somali women do not practice family planning, and we wanted to have that conversation with the Somali people in Mandera and also the Somali region of Ethiopia, because in Ethiopia we have a region called Somali region, because it looks very strange that the Somali people have been divided into 3 different countries. They are the same people in Kenya, in northeastern Kenya, and there are also an entire state in Ethiopia called Somali region. So we were working in Somali part of Kenya and also part of Ethiopia to promote reproductive health rights. Because for the women we worked with, most of them, and even the male, they were saying that they don't want us to use the word family planning. They don't want anything to do with family planning. So we had to change strategy and talk about child spacing. That there should be an healthy way of spacing children so that we give them proper time to have an healthy growth. That project we started with a survey, a baseline survey, from which we had to establish some of the data which we can use at the end of the project to gauge whether we succeeded or not. We have those reports. If you are interested on finding more about it, I will just mention them briefly. Then divided by skilled birth attendants compared to the national average is 61.8% at that time when the project was going on. That was in 2019, 2020. So you can see that most of the women in Somali, the Somali community that is in Mandera County, most of them do not seek maternal health services from the hospitals because they have their own beliefs. For example, when they come to hospital, they find it is male with midwives and other things, so they shy away from seeking those services. The second project which we have been implementing, it's an ongoing project which is going to come to an end this year. It's a project funded by the EU, the European Union delegation to Kenya. And this project is about supporting ethnic minority human rights defenders. So at MRG, we believe that we should not speak on behalf of minority people or indigenous people. We give them a platform to advocate for their own rights. So under this project, we have done data collection, we have supported community dialogues, we have conducted training, we have supported indigenous people through training on, for example, planning and budgeting processes, so that they can be able, if you don't know how the process goes, at what time you should participate, most likely you will never be part of that process. So we did trainings on international human rights and SDGs because the project was focusing on access to education and healthcare. We have also supported these communities to conduct their own public participation forums. So we support them to have preparatory meetings where they discuss the issues they want to present, they have them down, and then they present them during the main budget public forums, which are usually held every year around April. We have also trained community volunteers, and these are people who offer psychosocial counseling to their own communities. So in the project, we work with ethnic minorities specifically. I should have mentioned at the beginning that at MRG we support ethnic minorities generally. So there is religious minorities. It depends in our country which type of minorities we have. There is religious minorities, there is linguistic minorities, and then there is ethnic minorities. So in Kenya, we are supporting ethnic minorities to have a voice in the policy making processes. So one of the shocking things I found out after census was conducted is that most of the majority communities in Kenya, they are easily identified. But when it comes to some of these ethnic minorities, especially the forest people, when I say the forest people are those communities which do hunting and gathering, like the Ogiek of Mau Forest in Nakuru and Narok. There is the Sengwel who are in Elgeyo Marakwet and also in Trans Nzoia. We have the Endorois. Endorois is a forest people. Endorois, pastoralist. Yes. So the Endorois is also an ethnic minority. Then we have another ethnic minority in Lamu, which is called Awel or Boni people. The Boni people are from Boni Forest. They are forest people. Before 1977, they were largely engaged in hunting and gathering. But you know, hunting was banned in 1977. So they had to change strategy in terms of their livelihoods. We also conducted a boot camp under this project. And in this boot camp, we brought together human rights defenders, sub-grantees, and other actors, including some journalists. And the aim was to show the importance of the power of networks, to build movements of indigenous activists. Our aim was to bring together these activists and encourage them to form a network so that they can be able to speak with one voice. Because we believe when you are speaking alone, you can even be easily targeted. But when these indigenous peoples are working in networks, they will be able to speak with a more strong voice, and it's not easy to target anyone. We have also been supporting advocacy, as I said, from the local level all the way to the international level. So last year, around November, we supported some indigenous people from various communities in Kenya to participate in some of the sessions at the African Commission. You know, in Africa, we have the African Commission, which it is one of the arms or organs of the African Union. So at the African Commission, they call it in full the African Commission on Human and People's Rights. It is like the human rights arm of the African Union. Because even at the UN level, when you say the United Nations, there is the United Nations human rights arm of it. So at the African Union, we have the African Commission on Human and People's Rights. So we do support nearly every year some representatives to go to the African Commission, which is based in Gambia. Mostly they go to Gambia, but this year they are coming closer home to Arusha in Tanzania. So sometimes they can come round. It is like the they call them UN Human Rights Office. Sometimes they can come to a country if they are invited. You know, these human rights bodies. They can only come, for example, to Kenya if there is human rights violations. Let's say the Shakahora massacre. If we want some international body to come and do investigations, sometimes if they are from the UN, they have to be invited. But most of the time, if the government is incriminated, they cannot invite them. So they will never come. Then we also support people to go to international fora at the UN. For example, the discussions around climate change. We have COP26 or 27. You were part of which one? 26? 27, which was in Egypt. So we do support some people to go there and be part of the conversation. Because we believe ethnic minorities and indigenous people, their voices are never heard at various policy-making forums. Before I started working for Minority Rights Group International, I was working for a national NGO here in Nairobi. Actually, their office is a neighbor to this hotel. And every time we had those patched forums at the national level, members of parliament could go to a few counties. You know, they don't go to every county. They don't go to the 47 counties. The budget and the appropriation committee only chooses a few counties where they go around and ask for people's submissions on budget. Like what we have had, the finance bill. They never went to every county. So whenever they go, they never reach these people, the indigenous people. They only get to some places or some towns. In Nairobi, they did it at some point. They only do it at Kawangwale, around Tagoleti Corner there. There is an office there. So it is very hard for the voices of indigenous peoples to be heard at the policy making table. So we try to support them to be part of this conversation. And what is sad, for example, some of the public participation processes, they are fraud. They are not very productive. Like what he was mentioning, we supported this community to make a petition to parliament. But the way that petitioning is arranged, you never get any feedback. Because what will happen, you will petition parliament. Once you have sent your petition to parliament, they will go and receive you. You submit a written petition, they will sign it, received. But once it has been received, there is no feedback mechanism. That is the biggest problem. Then finally, we are also supporting legal cases for indigenous people around the world. And one of the key cases which I would like to highlight quickly is the Ogiek case, where Ogiek people is also another indigenous community, as part of the Kalenjin, a subtribe of the Kalenjin. They were being evicted from their original homes, that is in the forest, which is the Mau forest. And then they were seeking justice in Kenya, domestic courts, for over 20 years. At the end of the day, when seeking justice locally fails or domestically, you go to the international mechanisms. Then they went to the African Commission. The African Commission referred them to the African Court. At the African Court, the case started in 2012. They were referred by the African Commission on Human and People's Rights to the African Court. African Court is found in Arusha. So in 2017, the case was determined. A judgment was released. And on this judgment, the Ogiek people won a case against the government. The case was against evictions from their original homeland, which is the Mau forest. And when they won the case, part of it, like the reparations, the compensation was remained and was also made. The judgment was made in June 2022. It was determined in that case that one of the things they were to be done, the government of Kenya was to pay them 157 million shillings as collective compensation for the entire community. Number two, and that one was for moral damages. There is material and moral damages. You know, when you evict people from a place, you come and destroy their property. Apart from destroying property, there is also moral damages. The number two, the judgment directed that these people should be returned, the Ogiek should be returned to their ancestral lands in Mau forest and be given a collective title deed within 2 years. But that, I will also comment about it because there is another case for the Endorois, which we also won in the year 2010. Up to now, it has never been implemented. So there is a case of impunity in Kenya where government does not respect court judgments. So this is a case of impunity. The Ogiek have won a twin case. One, a general case, then the second one was for reparations. They have never been implemented since 2017. Every year I get invited by the Ogiek people to go and commemorate their winning of the case. But you see, 6 years, this year we celebrated the 60th anniversary since they won the case against the Kenyan government. And the government has not implemented that judgment. The other direction from the court was the recognition of Ogiek people, their language, culture, and religious practices. And then the third one, the fourth one now, non-repetition of these violations, that these people should never again be evicted from their ancestral lands. And finally, there was establishment of a community development fund within 1 year of the judgment. So when was the judgment made? 2022. So it was in June 2022. So from June 2022, it means by June 2023, it is already 1 year is gone. And that fund has not been established, and they have not been compensated as directed by the African court. Finally, the court directed that the government should publish within 6 months the judgments in official gazette and in a national newspaper. Nothing has been done. So what did the government do? The government created a task force, which was here in Kenya, I think last year. It concluded their work. They even produced a report. But just like all the other reports, including the Ndungu report and many others, the report was released and served. It was never made public. So that is another big problem we have in Kenya. We create commissions, we create task forces. They produce nice reports. For example, I'm told if we could have implemented the Ndungu report, some of the historical and injustices could have been solved. But we are here now, we have spent millions of taxpayers' money on those task forces and commissions, but we have nothing to show for it. So those are some of the things we do in Kenya. I know this deviates away from the main topic for today, but it is important we also give you perspective about the other work which we are doing. Otherwise, thank you very much. If you have any question, I will be glad to answer.